Welcome! My name is Dr. Kiepert Truong, and I'm the owner of A First Foundation, which is a private practice that serves young children and their families by supporting them through developmental, behavioral, or learning challenges. Today I'm going to tell you a little bit about my mission, approach, and services, and why I'm unique and how you can get started working with me. I launched A First Foundation about 10 years ago with a mission to promote healthy early childhood development by supporting those early first experiences that will be the foundation for your child's success in school and in life. I work with children as young as infants up through about third grade, and I'm really passionate about building a child's confidence as an individual. I'm also really passionate about partnering with parents and helping them to be their child's first teacher. I help them advocate for their child's success, whether that be educating them about early childhood development or giving them some practical tips for handling their child's behaviors. My logo can be seen here, and my logo really represents these concepts and my mission. Blocks can be seen as an early childhood learning tool. Here they also represent the fact that I'm building the foundation, those foundational skills that are going to carry your child through successful moments in life. The word first refers to the fact that I'm working with young children, oftentimes helping them to build their very first experiences. It also represents the idea that there is a strong foundation that needs to happen early, and the earlier the better. The hands represent the family system, so adults support and guide children, and I'm here to help facilitate and make that process a little bit easier and less cumbersome for families. So now I'm going to talk a little bit about my approach in private practice, which is systematic, explicit, and diagnostic. When your child comes to work with me, everything is individualized and it's going to be based on their own needs. This is not a one-size-fits-all approach, so it's highly specific and targeted. I am trained in the Orton-Gillingham approach to literacy instruction and other programs like Zones of Regulation, for social-emotional regulation, and Seeing My Time, which helps children with executive functioning skills. These are evidence-based and they are very multisensory and hands-on. So, I'm using tools that are going to be interactive. Developmentally appropriate practice is so important for learning and to keep children interested. So when your child comes to me, they will be engaged and doing activities that are appropriate for their level of development, which of course in many cases means that these activities are going to be play-based. I use diagnostic assessment to help outline your child's intervention goals. And all of these sessions are documented with notes and progress reports that are given periodically to ensure that the goals are being met and adjusted as needed. So I provide home fun lessons, and I didn't make up that term. So Dr. Warren, who is a learning specialist in private practice, a pretty famous one, she calls them home fun lessons, and I like that, so I call them that too. So home fun lessons are going to be provided to help keep the learning going at home and kind of help to expedite your child's progress as well. Again, I really value the partnership with parents in their own child's education. So parents are always going to be kept informed about what's going on, what we're working on, and how the child is progressing. Next, I'm going to outline what I offer in private practice. I do offer developmental therapy, which is also referred to sometimes as special instruction with kids under the age of 5. I use a very integrated, holistic approach, and I would be using play-based therapeutic methods with your child with the goal of strengthening cognitive skills, social-emotional development, challenging behavior, and early communication. I also offer educational therapy, and this would be for children who are experiencing common barriers to learning. So something that's affecting how they're learning. And we might work on executive functioning skills, or sometimes we work on social emotional needs or self-control. Sometimes these children have an ADHD diagnosis or an executive function deficit, or sometimes they have sensory regulation issues. This is different than talk therapy, so I'm not a therapist. This is more an educational model. I use education-based programs and lessons. So one of the most common learning difference or disability is in reading. As a professional, I specialize in early literacy at the preventative and early intervention stage. So if your child is having difficulty knowing the sounds that the letters make, blending sounds into words, segmenting words into sounds, being able to identify a rhyme, or produce a rhyming word, you might want to reach out for support in reading. I also provide early childhood assessment. I can do really elaborate evaluations where I'm doing an observation and looking at your child's educational records. These are not done primarily for the means of diagnosis. These are done more to identify and help you understand your child's strengths and areas that we need to work on. I also provide support for parents. So I am a qualified parenting educator, and most of the work that I do with parent coaching addresses challenging behaviors, understanding child development, or helping parents find a preschool or a child care center that is a good fit for them. So now I'm going to talk about who I work with. So children identified with learning challenges or barriers such as dyslexia, ADHD, a developmental delay, or an executive functioning deficit sometimes come to me for support. I also see children who don't have a diagnosis, and they may not even qualify for early intervention services, and therefore, their parent is reaching out to me because they feel that they still need support, even though they don't meet the criteria. Sometimes I see children who have a family history of a learning challenge, and the parents are trying to get ahead of that and provide support when they know it matters most. I also see children who are in the diagnostic process. So, they might be getting evaluated by their school district, and they're waiting to see if there's an official diagnosis. But that doesn't mean we can't start intervention in the meantime. I also work with children over the summer who really, their parents just want some extra support over the summer while they're not in school to kind of prevent that learning loss that can frequently happen. One of my favorite things to do is to help support preschoolers and pre-K students as they enter school for the first time. And so sometimes parents just want to give young children a little boost right before school starts, and they want to make sure they're ready for the success that they'll need in kindergarten and to start their school career. I also provide support, like I mentioned, to families who might just need help navigating various parenting challenges. So here's a little bit of information about my credentials and training and who I am. So I have a doctorate in educational psychology from Temple University. I do have a background and training in psychology as well. In addition, though, I consider myself an educator and a teacher, and I have a certification in nursery school and kindergarten. I do also hold a certification as a structured literacy teacher, and I am a qualified professional parenting educator, so I had to show proof that I provide parenting education in a certain manner. I am trained in a bunch of different evidence-based programs. You can see them listed here. Many of these are reading programs. Some are social-emotional curricula. I'm trained in positive discipline. And I think it's important to note that programs don't teach children, but teachers teach children. So when I'm working with your child, I'm drawing on my knowledge from a bunch of different programs and areas, and I'm going to create an intervention that is going to help your child progress in the best manner. So what makes a First Foundation unique? So I think one of the most important things to mention is that I do specialize in a particular age group. So I'm working and have devoted my entire career to working with early childhood and really understanding this period of time that's so important from birth through about age 9. Another thing that makes me unique is that I really strive to partner with parents. So, I'm providing you expert guidance for all walks of development, and I'm going to ensure that you're included in the process. So I'm going to give you information about exactly what's going on in sessions. I might provide things in writing to you. I'm going to provide written progress reports. So you're going to be my partner in education, and I'm also going to teach you about the things that your child is learning. My practice is small. So, when you come to my practice, you're going to work with me. And, like I mentioned, I have specialization in early childhood, early literacy. So, I'm not handing you off to somebody else. I've gone to school for a very long time and have training in multiple areas. So you are going to get my services. I think being small as well helps me to build high quality, personalized relationships with my clients. I'm going to be focused on learning about your family and what makes your child an individual. I have a background in psychology, so not only am I an educator, but I have a background in psychology. So, that allows me to really see things from a holistic perspective. So I can recognize the interplay between the developmental delays as well as some of the social emotional components of learning or of developmental or behavioral needs. And finally, I am a parent with perspective. So I have 2 children myself. They have food allergies that are life-threatening, so that is considered a disability. They also have various learning needs. So when you come to work with me, I can, guide you based on my training, but also as a parent who has kind of been on an advocacy journey myself. So now I'm going to cover some frequently asked questions about my private practice. Where are you located? I am located in Paoli, Pennsylvania. I have a small office that is kind of set up for intervention in like a classroom. Tons of books in here. I might give a tour of the office in another video. How long are sessions? So typically sessions are 1 hour in length. Occasionally, if a child has a shorter attention span or difficulty, or there's a special need, I might do 45 minutes or 30-minute session. But typically I see students and clients for an hour. If you're coming to me for developmental therapy, part of the session is with the parent and the child together, and the last half is with the child individually. Do I offer groups? So prior to the pandemic, I did offer groups. I would offer parent-child programs, caregiver and me programs. I would also offer enrichment programs for children independently. And these were all groups. I'm currently looking for a location to hold groups, and I'd like to get back to that. If you're interested in a group, please reach out to me. Is insurance accepted? So currently, I am a private pay only. What I do can sometimes be referred to as tutoring with the older children. So tutoring is not covered by insurance. Many parents, come to me and their child was already recently evaluated, and they're curious if I kind of accept their report, if I need to do my own assessment. And, as long as the information is within the last 6 months, I'm more than happy to read through data or someone else's report or your child's IEP and kind of come up with a plan of action based on that. How do we get started working with you? So on my website, which is Dr. Marissa Kiepert, Kiepert Truong, Truong.com, there is a tab called Getting Started, and it's going to walk you through step by step exactly what to do to get in touch with me and what the procedure is. Same thing with my policies. So my policies can also be found on that website. So thank you for watching and learning about my private practice. One thing I can't stress to you enough is that if you have concerns about your child's development or their progress in school, now is the time to act. Okay? I never encourage the wait and see approach, because intervention, it works, and it's going to give your child the confidence that they deserve. And as parents, you should never have to parent alone. Parenting is hard. So I'm just a phone call away if you need support with learning or your child's behavioral needs. Feel free to contact me at the number listed or shoot me an email to get started. Thanks again, everyone.